Introduction to the Food Policy Council. We are a network that really is trying to strengthen Rhode Island's food system across the state. The Food Policy Council itself was launched in late 2011. And the goal is really to create a network to really connect people statewide, to raise awareness about issues related to the food system, to try to get projects and policy changes happening that are going to make our system stronger and more equitable for everyone. So, Food Policy Council has 4 major goals related to production. We're trying to increase the amount of food produced in Rhode Island and the demand for that food. In terms of economy, we're trying to make sure that the food system of Rhode Island is recognized as a stronger and significant part of Rhode Island's economy. In terms of access, we're working to ensure that all Rhode Islanders have access to fresh, affordable, healthy food. And in terms of environment, we're really working to try to make sure Rhode Island's food system strives for zero waste. So increasing the amount of food that doesn't get thrown away, but either gets moved to people who need it or gets composted, but that we're really trying to move the food system towards a zero waste system. So this really is about bringing people together, obviously around food, getting them to talk about issues, and hopefully inspiring them to get involved and sort of take action. So if you're interested in getting involved, there's a sign-up sheet on the back. There's information about our work groups and committees. Myself, Jennifer Quigley-Harris, in the back there. Could I get anyone who's a council member from the Rhode Island Food Policy Council just to raise their hand? Food Policy Council member, current or future. So if you see someone whose hand is up, also great people to talk to about ways to get involved as well. Quickly about this series, this is called Food Matters. This is our 4th and final one for 2013. The goal has really been community conversations, getting people talking about an issue. And so there's going to be some presentation piece tonight, but we're also hoping this is an issue that all of you can ask questions about, give your thoughts about, give a sense of what's important to you around food and health. So we've posted one on what is community food security and really diving into what that means. One on institutional purchasing, hospitals, the Department of Corrections, other parts of the state. And then we had our last one before this was on food waste. So how are we really thinking about ways that we can reduce the amount of waste in that system? Tonight's topic is about food and your health. And I'm really excited to turn this over to Gemma Gorham, who's the chair of the Rhode Island Food Policy Council and also the project director at Brown University's Institute for Community Health Promotion.
Great panel tonight. We're going to talk about how the food system affects our health. I'm going to share some stories about a program called Fresh to You, which attempts to increase access to healthy food. And we have wonderful speakers here tonight. I'll introduce Chuck Jones, who's the executive director of Thundermist. You know, there's one in Woonsocket and this beautiful new place here that I've never even seen. Thank you so much for coming. Melissa Sanzaro, who I don't know your new title, but she's way up there at the Providence Housing Authority. We had Fresh to You markets at both of those sites. Hilda Castillo, who is the field coordinator for the Fresh to You Research Project, is going to share her experiences. And Robert Catanzaro, who is the fruit and vegetable distributor, was unable to come due to some family issues and restaurant issues and life in general. So we're going to fill you in on, we know what he thinks. He's not shy. So we're going to share his thoughts because we think it's really important that you get the perspective of the food distributor. So without further ado, we're going to start with Chris. Oh, I didn't even introduce you. My first name. Chris Asura is the food system coordinator for the Rhode Island Department of Health Initiative for a Healthy Weight, which is the obesity prevention program. And he's going to get us thinking about how the food system relates to the one.
This is a presentation actually kind of broken apart from something that I presented to a group of state leaders. I think one of the first things that I like to identify is what exactly is the impact of healthcare in the United States right now. Beyond what the impact of healthcare in the United States, what's the healthcare impact in Rhode Island? A good way to gauge this at least right off the cuff, is what are the costs? So per capita healthcare expenditures in the state, that's per person in the state, we're spending around $8,300, right? Total healthcare expenditures is $8.7 billion. And the national level right now is actually nationally and in Rhode Island, 17.9% of our GDP. So that means 17.9% of our gross domestic. How it affects economic growth. So what you see is this inverse reaction to this healthcare costs increase, our GDP actually starts to decrease. You know, and I think that this graph or this scatter plot really paints a picture of what we're getting for that money. And what we get for that money is poor health outcomes. So the way that we gauge whether we're getting a good or a poor health outcome is through life expectancy. And if we look at this, what we see is that way over there, the United States is spending right around $8,400 per capita. If we bring it over here, what you see is South Korea. I'm sorry, the circle's a little off. But South Korea spends about $1,800 per capita and gets better health outcomes than we do. Now, there's a lot of reasons why that is. I think that access to primary care, environmental health, and a myriad of other reasons affect whether or not we're getting those really positive health outcomes with the money that we're spending. But beyond that, there's also population health. And I think that this is really what we're here to talk about. There's two things at the top here, genetic predisposition and sedentary lifestyles, that obviously are major components of whether or not the population is obese or not obese. And there's a variety of different issues that lead to this, whether it's street safety, whether it's family history, and since that's not really what we're here to talk about, I'm not going to dive into it too far. But what I do want to summarize the nexus concept. I like to think of it in outcomes and outputs. And outcomes are usually how we qualify health, and outputs are how we're going to qualify economics. So this is my little statement here. Suboptimal inputs, which are few choices, lead to negative health outcomes. Those negative outcomes lead to poor economic outputs, which is your GDP. Right? So here's this cycle, and it all works together. So what we put in, if it's bad, is what we get out, which is bad. Compounded on this economic. So if you think about it, per capita, not per capita, but the average income in the state per person is $28,000. Health can't do it. Department of Administration can't do it. Food Policy Council on their own is not going to do it. This is an integrated effort. Everyone needs to cross the borders and figure out who's running one of these community gardens. Are there people in your network that you can reach out to that are nutritionists? Is investment in creative solutions that are targeting the food health crisis. And with that, over to the next presenter.
It started in about 2006 when I was Chris, meaning I was the nutrition coordinator at the health department for the Initiative for a Healthy Weight. Eliza Lawson, who is now the director of that program, hope that's the right title, was the physical activity coordinator, and we were instructed from CDC to figure out why people weren't eating more fruits and vegetables, and to try to address that in a socially appropriate way, not just education. Fresh fruit and vegetable markets directly into low-income communities and work sites, and sells the produce at or below retail price. When we were trying to figure out why aren't people eating more fruits and vegetables, we were keeping them from eating fruits and vegetables. And we did an online way back when like using SurveyMonkey was a really big deal, right? We were so excited. First online, me, who were public health nutritionists spending their whole life educating people, were pretty much wasting their time because everybody knew they needed to eat more fruits and vegetables. Everybody wanted to eat more fruits and vegetables. Those were not the issues. The real issues were they cost too much, they didn't like the quality of what was available, they were way too busy, hectic lifestyles to go find healthy food. And in low-income communities in particular, they had limited access. At this point in time, grocery stores were moving out to the suburbs, and the options weren't good. So it wasn't an issue of people not knowing. It was an issue of there were really more social determinants of health that were driving this problem. And almost 92% of adolescents aren't eating the amount of fruit and vegetables they need. That's like a crazy high number for a really Let's buy the fruits and vegetables directly. Let's not mark it up the amount they do in the supermarket, and let's bring it to them. So the first thing I did was go to the Division of Agriculture and talk to Ken Ayer and say, I want the local farmers to help with this. We could provide a tortilla, as you can see. We're excited about this. They thought this could be a real moneymaker because businesses need to make money to survive. So the president of Tortilla came, top people came, the Martin Luther King Elementary School. Can you hear? No. This is by 2012, whatever that is, award, National Association of Housing Redevelopment Officials Award because of Live Well, and bringing fresh produce to the doorsteps of Providence Subsidized Housing Complexes. So that was really exciting. They were a great partner to work with, the Providence Housing Authority. Picture of Fresh Chew, I want to talk to you about some challenges that we face. What the biggest challenge is that we had no implementation funding. We could only go to the sites that were grant funded, which meant we couldn't make this thing work. We couldn't go to the big enough work sites. We knew where they were. They ordered a lot on our online program. Like if I went to Amica one day and the next day went to a low-income housing complex, the sales would be enough to cover the cost of bringing the market, but we have to go to the markets only that are in the study because we don't have implementation funding. The second biggest challenge is we couldn't figure out how to get enough wholesale local food in an easy way every day. Like we just went to Tortilla and we went to, what's the place in Cranston with this? Confrana Farms, to get local food in the summer, but the demand was much bigger than what we could do, and logistically, these guys start around that now. We have a few possibilities. And then we want to partner with farmers at Farm Fresh Rhode Island and urban growers. We have people growing African vegetables and that might need to get distributed at the markets that we had to go to, basically, that were in the study. So last year there were $141,000 in sales, $31,000 in profit, and $25,000 in net profit. Right now we're at the busiest point we've ever been at. We're bringing 10 markets a week. So people are, the markets, and we've got one truck and trailer that was retrofit. Oh, I forgot that part of the story. So we decided it might be cool to have. That's the story of Fresh to You. I would now like to have the people who really experienced it come up and share. So, Melissa, you want to come up and tell us what it was like for you at Providence?
Hi, everybody. Thank you for having me today. So I'll tell you a little bit about the Providence Housing Authority, just so you kind of get a snapshot of the population that we serve. I'm the Special Projects Office Director. Nobody ever knows what a Special Projects Office is. I go to conferences, and if I see someone that has special projects, we bond immediately. Special projects is basically anything the Executive Director tells you. But it's fun stuff. It's system improvement, funding development, looking for grants, programs, collaborations and partnerships, and special projects. And I'm really proud to say it's part of the executive level. But my favorite part of it is that we're the liaison for the resident associations at all of our developments. And that's the most important thing, and it's the most important piece of why I go to work every day, is how to serve your residents. So you're at the executive level, but you're on the ground speaking with the residents at all times is my favorite part. So we have that as well, and affordable. In our populations, we even have a problem with people just not being able to get enough food, period. We've had to put in food pantries in 2 of our developments. One's in Chad Brown, it's new. Which serves a huge community of 475 units. That's very successful 2 times a month. In the Parenti Villa Food Pantry, this is all funded by legislative funds, is very successful, but it serves 480 people. It only is there 2 Saturdays a month. And it's not just extra food that they get. They need it. Some of the people need it to survive. So it goes beyond just fresh. Nutrition is a problem, and it's serious, but we loved having you. We love to see that. Any way we can collaborate, we will be there for you.
Thank you.
We're a community health center. We're in 3 communities in Rhode Island: Woonsocket, West Warwick, and Wakefield. Every year we serve. Last year we served about 35,000 patients in medical, dental, and behavioral health care. But I think the thing that differentiates most community health centers from what would be a typical private practice, not only the comprehensiveness of the medical and dental services, but the fact that it's really ingrained in our mission and in our culture that we don't just deliver healthcare. We don't just try to improve the healthcare services, but we try to improve health of our communities. It's not just our patients; it's about the community. So in that, we have we really try to get to those barriers that people are facing that prevent them from leading healthy lifestyles. Great start with you guys up in Woonsocket. It was the first real introduction of food into us as a workplace, and also for a lot of our patients. We've continued that with Farm Fresh Rhode Island. I see Kayla here. She was a huge part of continuing our farmers market access up in Woonsocket. We do it outside in the parking. We shut down the parking lot once a week during the summer months, and then down here along the bike path. And that's been as an organization, we also subsidize our employees' wellness benefits so that they can use up to $200 a season in purchasing that fresh fruits and vegetables. We're part of the community, and our employees are facing the same challenges. And I got great stories from our employees when we decided to open that up. People enjoyed having the market there, but when we opened up the wellness benefit, that they could now have an option to spend on the gym membership or the farmers market. I got notes from single moms who had no ability to buy or afford fresh fruits and vegetables for their kids. So for the first time, we're now on a weekly basis loading up and bringing that food home and really introducing that to the family. So even for healthcare workers who knew how important it was to eat and live a healthy lifestyle, the affordability just wasn't there. So it was impressive to see that example. Here in West Warwick, we don't view ourselves as an organization that's going to bring fresh fruits and vegetables and healthy foods to the community. But I think that as a trusted healthcare provider and local expert in the community, I think that bringing visibility and education and access on a small scale has a disproportionate impact because of the intersection with the healthcare side of things. So that drives a lot of what we do with, say, the Thunder Kids program in Woonsocket, where we have 25 to 50 kids. We have a nutritionist, an athletic trainer. We get them out of the school, and we try to get them introduced to healthy lifestyles. Who's into gardening, she was doing depression group visits out there in the garden while her patients were sort of pruning the tomato plants. So it went so far beyond just having a couple plots of land. It was really, really impressive.
8 o'clock, we would encourage, if people want to stick around and continue the conversation, you're welcome to connect with others. But a big thank you across aisle, Hilda, Melissa, Chuck, This is the last Food Matters Community Conversation Series for 2013. This is absolutely something that we would love and look forward to continuing next year. If you have ideas, if you are interested in helping plan these, please touch base with myself and Jennifer. It's something that we're really thinking about for next year. What are topics that are really relevant? What are communities that really would benefit? A big thank you to Thunder Miss for hosting tonight. And thank you all for coming out.